welcome to another lecture, and today we'll be discussing something about recent advances in diagnosis and management of celiac disease. So before I begin, I would like to request you to like, share, and subscribe to the channel, and the full video is available on my app. So please make sure that you download the app and check it out once. And I post daily questions on my Instagram. So if you haven't already followed me, please make sure you follow me. So celiac disease is an autoimmune disease. As you know, celiac disease is an autoimmune disease. And what are the high-risk population where you need to go for diagnosis? So high-risk population is type 1 diabetes mellitus, autoimmune disease, including thyroiditis and hepatitis, JIA, juvenile idiopathic arthritis, okay, Down syndrome, Turner syndrome, Williams syndrome, and IgA deficiency. Also, one more important high-risk factor is family of a celiac disease. Family of patient with celiac disease. So these are the high risk where you have to go out of your way and make sure that they are diagnosed. Because see, celiac disease, the treatment for celiac disease is just one, that you have to absolutely avoid gluten for your life. And for that, sometimes it is very, very difficult for the patient to accept the diagnosis. That is why you have to be very careful and you have to counsel the entire family. Okay. Now, the two questions that are mainly asked are that which is the most specific antibody and which is the most sensitive antibody, which is the screening test of choice. So, firstly, the screening test of choice is IgA TTG. Okay, so this is very, very important, that screening of choice is IgA TTG, while the most sensitive antibody is also IgA TTG. Okay, and it has the sensitivity of 98%. So the most sensitive is IgA TTG. Okay, now next is most specific antibody. So most specific antibody for the diagnosis is anti-endomysial antibody, IgA. So this is the most specific antibody of the celiac disease. So these are the important facts that you need to know about celiac disease. Now, HLA-DQ2 and HLA-DQ8. They are the HLA which are associated with celiac disease, and this is the HLAs that you have to be very, very careful. Now, biopsy that is being done. Biopsy that we do in patients of celiac disease, when do we do? So actually 3 biopsies are to be done ideally. When should be 3 biopsies done? First is at diagnosis. Second is 2 years of gluten. So you have to stop the gluten and do it after 2 years. You have stopped, post 2 years you have stopped the gluten. And third is 2 months after you have given a trial of gluten. So this is a very long history of disease, and this is how you usually diagnose the patient. The 3 ideal biopsies are as I have written over here. I hope you like the video, and I will see you in the next one.